Alright guys, so today we're going to be looking at a sheep heart that we have already sliced open, but here we can see the apex of the heart. So then we have the base of the heart, so it's opposite of what you normally would see or call apex or a base, but here we have the right atrium and ventricle, the right side of the heart, and the left ventricle and left atrium. You can see the auricles of the atriums as well. And some of the blood vessels have been sliced off, so we can only see the pulmonary trunk and a bit of the aorta there. So we're gonna open it up. And here you notice very quickly that the myocardium is so much thicker on the left ventricle of the heart compared to the right ventricle of the heart. So right here we have the auricles of the left atrium, pockets where blood can pool and cause complications later. So this is the left atrium, and it goes down the bicuspid or mitral valve. Connected to those, that valve is the chordae, tendineae, and the papillary muscles attached to the papillary muscles. And then you see the network of flesh, which is the
chordae trabeculae. And then right here we have the interventricular septum, which separates the two ventricles. But before we get there, right here would be where the aortic semilunar valve is, but it was cut open. And then you can see the little valves right here. And there's little holes in these valves, which that's how the blood gets to the coronary arteries. And then you can see the aorta. And then when we move over to the right side, as you can tell, it's a lot smaller than the left side, because the left side of the heart has to pump all the blood throughout the body. And so you can't see this side as well, but if you get in there, you can kind of see the chordae trabeculae. You can also see some of this chordae tendineae and the papillary muscles. You can't really see much of the tricuspid valve, but it would be right up in here, connecting to that right atrium. And then all the other vessels that are usually up here have been taken off, so you can't see much of those.
Yep, so this is our sheep heart, and thank you. All right, guys, so we moved on to a quick little model just to show the trace through the heart. So of course, here in the front, we have the right atrium, left atrium, right and left ventricle. So we're gonna open this up. Alrighty, we're gonna leave this part here. We're gonna need that in a second.
Oh, also, there is the auricles, you can see right here. And there's, you can't see on here, but usually little pockets. That's where the blood can get trapped. So those are the auricles. And here you can see the coronary arteries and veins.
Thank you. Alrighty, so of course we have the superior vena cava here, dumping blood from the upper extremities of the body, head, into the right atrium here.
And then we have the inferior vena cava taking the blood from the lower portion of the body and bringing it back into the right atrium.
Yes, so in our right atrium, we have the tricuspid valve, dumping blood into, filling the right ventricle. And off of the tricuspid valve, you have your chordae tendineae attached to your papillary muscles. And I guess you could see a little bit of the chordae trabeculae, but you can see it better over there, so we'll discuss in a minute. Alrighty, so let's focus. So yes, we have the right atrium here after the blood is being dumped from the superior vena cava into the right atrium. This is our tricuspid valve and our chordae, tendineae attached to papillary muscles. So this is in the right ventricle of the heart, small right ventricle of the heart. So then blood is pumped into the pulmonary trunk here, which you can see. The valve, though, is on this part. This is the pulmonary semilunar valve, which you can see right here. So the blood is being pumped out of the pulmonary vein to, so yes, our pulmonary trunk to our pulmonary arteries going to the lungs. So here's the right and the left. All right, so from the lungs, you'll go back to the heart.
Through the pulmonary veins.
On each side.
And then from the pulmonary veins, it's going to come back in through the left atrium and go down into the mitral or the bicuspid valve, and goes down. There's the chordae tendineae and the papillary muscles again, and then you can kind of see the chordae trabeculae. And then you can always tell, so the left side from the right side by the amount of the myocardium. You see it's thicker. And then you have the interventricular septum here that divides the two sides. And then so when we get down here into the left ventricle, we go up into the aortic semilunar valve and then through the aortic arch, which takes the oxygenated blood through the body.
Yes.
So you can't see it on here, but like we spoke about before, there's little holes in the aorta that allow for blood to go to those coronary arteries.